my name is Jocelyn Morales, and this is my head-to-toe assessment for NUR 3066C, Summer C. Hi, my name is Jocelyn Morales. I'm going to be the nurse that's doing your head-to-toe assessment today. Is that okay?
Yep.
Alright, so first let me just check your name and date of birth. Can you confirm it for me?
It's John Doe, 8990.
Perfect. Okay, let me just go ahead and wash my hands and put on some gloves, and we'll start your assessment.
Okay.
Okay, so we're going to start with your head first. Is that okay?
Yep.
Okay, so just a couple of questions. Any history of headaches?
No.
Seizures?
No.
Any head trauma in the past?
No.
Okay, so while I am assessing you, just let me know if anything is bothering you or if you have any questions, okay?
Okay.
So first we're going to note the two facial symmetry landmarks. The first one being the palpable fissures, which are the eyes. Open your eyes, please. There and there. They are symmetrical. And also the nasolabial folds, which are right here. Okay, so next I'm going to palpate the head and the scalp. So while I'm palpating, just let me know if you feel any tenderness or pain.
Okay.
Any tenderness?
No.
And no pain?
No.
Okay. Noting the hair, color, texture, and distribution appears normal. Okay, next is palpating the temporal arteries. Okay, and the temporomandibular joints. So I'm going to have you open and close your mouth for me when I ask you to, please. Okay? Open, close, open, close. No clicking heard. So next I'm going to have you do a series of things, okay? So first thing we're going to do to test cranial nerve 5 is, can you clench your teeth for me?
Sure.
Okay, one more time. Perfect. So now I'm going to have you smile. Okay, can you puff up your cheeks? One more time. Perfect. Squeeze your eyes tight. Lift up your eyebrows. One more time. So now with the wrinkling of the forehead, we're testing cranial nerve 7. Okay, so now we're going to check extraocular movement, which tests cranial nerve 3, 4, and 6. Okay, so I just need you to look straight forward. Follow my finger, only using your eyes, okay? Great. Now we're going to check visual fields by confrontation. I'm going to give you this little square. Cover your right eye first, and I'm going to cover my left eye. I'm going to move my fingers into visual field. Just let me know when you see it.
Okay. See it.
Next.
Okay, see it.
Great. Thank you. Now we're going to check for pupillary response. So right now I would just dim the lights to make sure that I get an appropriate response. Look straight forward, please. Okay. I'm going to shine a light into your eyes, okay? Just look straight forward. Yeah. Great. So now with the ears, I'm going to check just to inspect and palpate them externally. So making sure that everything is normal. Okay, so no lesions and the inspection appears normal. Okay, so next we're going to inspect and palpate the nose. So have you had any nasal trauma?
No.
Any difficulty breathing through your nose?
No.
Okay, so now let's just look. It's midline. Now I'm going to check for nasal patency. So I'm just going to cover up one of your nostrils and you're just going to breathe in, okay? Breathe in. Okay? Great. So next we're going to move on to the mouth. So I'm going to inspect the lips. Can you open your mouth for me? The gums. Okay, can you stick out your tongue? Lift it up for me. Okay, great. Can you see? Open your mouth wide. Stick out your tongue. Can you say ah? Okay, so I'm checking for the palate and the uvula, which would be cranial nerve 10. Okay, so now I need you to stick out your tongue.
Okay.
Can you move it from side to side? Great. So I'm checking for tongue movement. Next, with your mouth closed, I just need you to stick your tongue to your cheek so I can feel.
Okay.
Okay, and now the next side. Great. Okay, so next we are going to identify the landmarks for thyroid palpation. Okay, so identify the hyoid bone, the thyroid cartilage, the cricoid cartilage, and then the trachea. So above the trachea and just below the cricoid cartilage, that's where your thyroid would be. So now we're going to palpate the thyroid gland, okay, with and without swallowing. Let me know at any time if you feel any tenderness, okay? Okay, now posteriorly. So I'm going to have you move your head forward and to the right for me. Okay. I'm going to displace the trachea and palpate. Okay, and then now move your head forward and to the left. Again, displace the trachea, palpate. Great. So now we're going to do it with swallowing, okay? So when I tell you, just take a sip, hold it, and then I'll swallow when I ask you to, okay? So now move your head forward and to the right. Displace the trachea again. Okay, take a sip. And hold. Swallow. Perfect. And then now move your head forward and to the left. Displace the trachea. Take a sip. Hold. Swallow. Great. Okay, so now we are going to, let me just take this from you. Now we are just going to palpate the nodes. Have you had any tenderness in any of your lymph nodes that you've noticed?
No.
Okay, so can you move your head to the left for me, please? Okay, so right now we are going to palpate the occipital, the preauricular, posterior auricular, the tonsillar, the submaxillary, the submental, and then now in this position it is a good position to check for the anterior and posterior cervical. So the anterior cervical, just the anterior triangle, and then right behind this muscle, you're going to feel the posterior cervical. And then for the supraclavicular, right above the clavicle. Any tenderness?
No.
You can also have the patient, can you shrug your shoulder for me? Up. Great. Okay, so I didn't feel anything swollen or tender. Okay, so next we are going to palpate the carotid artery one at a time, and it's very important to do that. Okay? Okay. And then now I'm going to have you hold your breath when I tell you to. Hold it while I listen, and then you can take a breath after.
Okay.
So now with the bell of my stethoscope, we are going to listen to the carotid artery. Okay? Just take a deep breath and hold. Let it out. Take a deep breath and hold. Let it out. No abnormal sounds or bruits heard. Okay, so next for this portion, we are going to start assessing the heart. So I had my patient lay down for me. It's always best to expose your patient's chest to listen to the heart sounds, but for this video we won't do it. We'll just visualize it that his shirt is off. Okay, so first thing is just identifying the areas that you are going to auscultate. So you're going to auscultate aortic area, pulmonic area, the Erb's point, tricuspid, and mitral area. And to begin, we are going to listen to his pulses and palpate them. Okay, so let me see both of your wrists. These are the radial pulses. Equal bilateral. Okay, could you just bend your knees for me? Okay, now we are going to palpate posterior tibialis. And then dorsalis pedis. Okay, now we are going to listen to the heart sounds using first the diaphragm and then the bell of my stethoscope. And now with the bell. Okay, and now we are going to listen specifically to S1, and that can be heard at the apex of the heart using your diaphragm. And now S2 can be heard at the base of the heart, also using the diaphragm. To assess for any S3 and S4 sounds, we're going to have the patient lay on left lateral. Do the left laterally for me. Okay, and then just listen to the apex of the heart, but using your bell. Move this on for me. No S3 or S4 sounds heard. Okay, so now we have moved on to the chest and the lungs. So first thing we're gonna do is percuss the posterior lungs. You're gonna start at the apices, so right up here, and then you're gonna work your way to the interspaces. Working your way down the lung field. Next thing that we're going to do is check for lung expansion and tactile fremitus. So for tactile fremitus, you're going to place the ball of both hands on both sides and ask the patient to repeat the word 99. Okay, so when I instruct you to, just repeat 99, okay? Go ahead.
99.
Go ahead.
99.
Again.
99.
Again.
99.
Again.
99.
Great. Okay, and then now I'm going to check for symmetrical chest expansion. Breathe. Take a deep breath through your mouth. Out. One more time. Great. Okay, so now we are going to auscultate the posterior, anterior, and lateral lung fields. Again, it's always important to have the patient, the area that you are auscultating be exposed so that you don't get any false readings. So with your diaphragm, you're just going to listen to the posterior lung sounds. Please, if you could, just make sure that you're taking a deep breath through your mouth and out, okay? Take a deep breath. Out. Again. Okay, and then now I just ask you to turn around, please. Face forward. Right there. And then we're going to listen the same to the anterior lung fields. Again, just take a deep breath through your mouth. Out. And now just to the lateral lung field. You just move your arm. Take a deep breath. And I'll do the same thing on the other side. Excuse me. Take a deep breath. Deep breath. Great. So now next we have moved on to the assessment of the abdomen. Previously, I had my patient go and empty his bladder just so it would make for a better assessment and it wouldn't cause any pain for the patient. First thing we're going to do is we're going to pretend like I'm lifting up the shirt because it's very important to get a direct visualization of what you are looking at. So can you tell me if you've been having any pain?
Yeah, I have.
Okay, so let me just inspect the abdomen and we'll get to the nitty-gritty of the pain, okay? Alright, so the first thing I'm going to do is just inspect. Note that the stomach is rising equally, that it's non-distended, things like that, hair distribution. And then now, using my diaphragm, I am going to listen to the bowel sounds, starting at the right lower quadrant and working the way of the colon to the left lower quadrant. Now, using the bell of my stethoscope, I'm gonna listen for any vascular sounds. So the first vascular sound I'm gonna listen for is the aortic. And then now we're gonna listen for the renal. The iliac, and the femoral. Okay, now we are going to move on to percussing the abdomen. So we're going to percuss all the fields in the same pattern, and then we are going to percuss the lower border of the liver. Okay, and now. Okay, and now we are going to move to palpate. First, we are going to palpate the abdomen, and then we are going to move on to the organs. So first, we're going to start with light palpation. So I'm just going to use one hand, lightly palpate. Any pain?
Yeah.
Okay. Any pain?
Yeah.
Any pain?
No.
Any pain?
No.
Okay, now we are going to move on to deep palpation. Any pain?
Yeah.
Any pain?
No.
Any pain?
No.
Any pain?
No.
Great. Okay, so now we are going to palpate the liver. And now the spleen. You can just- Okay, now each kidney. Okay, now. Alright, so actually let's go ahead and move on to ask you a little bit more about the pain.
Okay.
So, what brought the pain on?
I was doing some exercises the day before yesterday, and then I noticed the pain.
Okay, and what makes it better? Is there anything that makes it better?
Just stopping
Okay, anything that makes it worse?
if I continue to do the exercise.
Okay, so what does the pain feel like?
It's like a sharp pain.
It's a sharp pain?
Yeah.
Okay, and how intense would you say it is? Mild, moderate, severe?
That's a mild to moderate.
Mild to moderate pain? Okay, where exactly is it? Could you point it out for me?
It's down here. On the right of
Okay,
my
so
foot.
your right lower quadrant? Okay, does it extend anywhere else to any of the other parts of
No.
your...
No.
Okay, perfect. How bad would you say the pain is from 0 to 10? 0 is no pain, 10 being the worst pain of your life.
Like a 5.
Like a 5? Okay. And when was it exactly that this pain started?
The day before yesterday when I was doing the exercises.
The day before yesterday? And have you noticed that it has continued on? Has it stopped at any point?
No, it's still going.
It's still going on? Okay. And how often? Is it just like a constant pain?
Yeah.
Okay. So for this portion of the video, we have our patient in a sitting down manner. Okay. So the first thing we're going to do is you're going to rotate your head against resistance. So rotate your head to the side where I am pushing on, okay?
Okay.
Okay? Good. Now, shrug your shoulders. Again. Good. Okay. Next thing you're going to do is you're going to pat your knee and then flip your hands and try to do it as fast as possible.
Okay.
Great. Okay. Next thing you're going to do is you're going to touch your thumb to each one of your fingers. So like this, and do it on both sides.
Okay.
Great. Next thing you're going to do is you're going to touch your nose and then touch from your nose to my finger, okay?
Okay.
Okay, so the next thing you're going to do is with your heel, you're going to move it from your knee all the way down your shin and then repeat on the other leg for me.
Okay.
One more time. Great. So now we are going to check the fine motor coordination with, I'm going to check the tricep. So you're going to leave your hand like it's dead. I'm just going to hold it. And then with my little hammer, which is imaginary, we will strike right here above the tricep. And then it would elicit a response. Okay, and then I would do this again for the patellar reflex. So I would have my patient's leg hanging and then strike right here. And then for the Achilles reflex, I would have my patient's foot, give me your foot, dorsiflex, and then with my hammer, just hit where the tendon is. Okay, so the next thing we're going to do, if you could please just take off your sock. And the other one as well. You're just going to tell me, I'm going to position your great toe, and you're going to tell me if it's up or down.
Okay.
Okay, your foot please. Okay, with your eyes closed.
It's up. It's down. It's down.
Okay, and then now the other foot. With your eyes closed.
It's down. It's down. It's up.
Okay, great. Okay, so next we are going to perform the Romberg test. So my patient has to be in a stand-up position for this. You have to want to be close by just to ensure safety of the patient. So I'm going to have you close your eyes and assess for any movement while the eyes are shut. Okay, so now you can open your eyes. Okay, now I'm just going to assess gait. So please walk forward for me. Okay, and then now as you turn around, walk heel to toe, heel to toe. Heel to toe, heel to toe, heel to toe. Alrighty, you can take a seat. Okay, so that concludes our assessment. Thank you very much for all your help.
Thank
I'm
you.
going to go ahead and just wash my hands. I'm going to document all your findings and I'll let the doctor know that you're in here.
Thank you.
Thank you.